So why you should be part of a psychologist curricle? I'll discuss about the cases and therapies which will be helpful in your clinical area, and it will be definitely free of cost. And also, and like yesterday I have shared about a node or bipolar client, right? So like that I will try to share which is ethical to share with you. So I'll share that, and soon I'll start to giving you a participation. It will be a digital certificate, and if someone is from Kolkata and you want to join internship or join in the clinical area, you can visit my clinic, but it will be definitely in the working hour only. I won't be able to give you extra time for this. So why I have started this, because when I was during my masters, when I recall those days, so I also had financial issue. I couldn't pursue courses because of the financial problem. So that's why I've started this for the students who, in the initial stage, who actually want to know the counseling part. Then we'll know how it is melancholia, okay, this chronicles of melancholia, and how melancholia is associated with the depression. So you must be knowing about the Hippocrates. He was a Greek physician, and he gave this theory of humor, and he said that 4 personality trait according to the 4 bile. Okay, if someone is joining, let me check. No, okay. Yes, anyone wants to say something? Okay. So if we go to the history, Hippocrates gave 4 personality traits. So according to yellow bile, so personality trait will be the choleric personality. So that person will be active, ambitious in nature, decision making, but person will be aggressive according to his theory. And when we talk about black bile, so people who are having imbalance in black bile, so they will have problem in depression, means he said melancholic personality trait. Okay. Then phlegmatic, so who are who have phlegm fluid in imbalance amount, so they will have phlegmatic personality trait. Okay. So when who have the phlegmatic personality trait, they will be reserved kind of person. Okay. Then last one is the blood. So blood, according to blood bile, he said that the personality trait would be sanguine personality trait. So means person will be very enthusiastic and very active. Okay. So from this melancholic terms came. Okay. Then he said that he also used some the treatment for the according to these humors. Bloodletting. Okay, what happened in the bloodletting? He used to cut in the veins or the arteries from the elbow and also the knee. Okay, so but the cons of this was that a person may go in shock because of that. Okay, because of high blood loss and also low blood pressure, and sometimes cardiac arrest may happen. So this is very dangerous. Other the treatment he gave, like bath and exercise and diet. So this can give relaxation for the patient with depression. Okay. And then come to how this depression term came. So it came from the Latin term, to which means that to press down. Okay. Which may also it can mean that to bring down the spirit or the soul. Okay, according to the Latin. Am I audible to everyone? Actually I can't see you, all of you, because I have using one device only.
Yes, you are audible.
Okay. So if anyone have any suggestion, any contribution you can give. I may be wrong somewhere, so you can correct me. Okay. So next one is the, and when we talk about the middle ages, okay, middle ages, so at that time what they think that people who are having depression, okay, so they thought that some evil or something is imposes within the person, okay, so they use some very cruel therapies. They use exorcism. So exorcism has actually different way. So some kind of they try to take the person to the trance stage, okay, some try to pray, okay, but some try to beat the person so that the spirit inside the person will go out, okay. Then others are like drowning the person and burning. So these are the therapies which were really cruel and very harmful for the patient. And also they lock up the patient in the lunatic asylum, it called, okay. So in then come some then Brighton area came in in 1621. This person wrote this book, Anatomy of Melancholy, okay. So here he contributed the written about the factor, social factor, psychological factor which actually causing depression, like poverty, it was a social factor, and fear and loneliness, these are the psychological factor. Also he recommended treatment like diet, exercise, traveling, purgatives. So purgatives can be two types, okay. So like here it written that to clear the toxin from the body, okay. So and also it can be clear the soul, okay. How will clear the soul? So when we ask about the client to talk, okay, to release the negative emotion, this can be added in a purgatives, okay. And to release the body toxin, they use enema. Everyone may know about the enema laxatives. It is used in the medical treatment actually. Then again, but bloodletting, he said about it. Then using herbs and music therapy today also we use, okay. So these are, so then come the enlightenment area during the 18th and the 19th century, okay. So this in this era, so it was said that the causes of depression because of the personality, individual personality trait, and also the genetic factor. It written that weakness in the temperament and inherited could be inherited factor can be, okay. So this means it is genetic factor and the temperaments the individual personality. Every individual have the we call it self, right? So it's depend upon the self. Then again the latter part, the doctor suggests that aggression can be a root cause of the depression, okay. Then again they have provided treatment, same treatment, and one more thing they have added here, water immersion, okay. So what happen in the water immersion? So the person will be under the water till the neck level, okay. He won't be drowning, but he will be the underwater. So it is actually relaxation therapy. Again the horseback riding. So what it is like entertaining, I mean, activity today we use. Then vomiting and enemas, already we have discussed this. Then the very first time this German psychiatrist Emil Kraepelin, so the first time he used this term depression, okay, manic depression. Okay, anyone is joining? Okay. So he used this term manic depression. So what do you mean by manic depression? So today we call it as a bipolar disorder, okay. So for the first time he used this term. Then so let me know, what do you mean understand by depression? So if we ask in a general population, if we randomly if you ask someone, so everyone must say that yes, I had a phase of depression. So people actually loosely use this term depression if someone is having low mood or sadness or stress out, so they perceive that okay, they are having depression, okay. So the stress can be in a positive way or it can be in a negative way, okay. How it can be positive way? So some simple examples. So we have to, when we have to open the door, so we have to give over a stress, right? We have to give pressure. So without giving pressure, the door won't be open, right? So which means that stress act as a motivating factor. So without having stress, like I'll give example mine. So if I don't have the stress about, okay, today I have the workshop, I have to prepare everything. So if I don't have that stress, I don't take this stress, this minimal level of stress, so I won't be working, right? So stress is a good for us to make us productive. Okay, so don't think that you should provide psychoeducation while patient come with depression, that this differentiation should made. Okay, everyone thinks that the stress is bad, stress is good, but it should take in a positive way, to in a minimal way, to that level that person can get solution, not the stress out by the problem only. Okay, so let's before going to the modern diagnostic criteria, DSM diagnostic criteria, let's go see what the past in the psychoanalytics theory said about this stress. So he said that the melancholia or the mourning, so this is because of the loss. Okay, if someone have any loss, it can be direct loss or the indirect loss. So any kind of loss, because of loss, the person show this melancholic or mourning symptoms. Okay, so he said that the person has the unconscious anger, where because of this loss in his life, they have the unconscious anger and self-hatred. And self-hatred means the person, if person is stopping care for herself or himself, so they, what happen in the depression, the person doesn't take bath, okay, doesn't take food, okay, sometime self-harm, like suicide attempt, right? So person have, because of the unconscious anger, they were having this self-destructive behavior or depression, according to the Sigmund Freud. So next say the according to the behaviors. So behaviors say that no, depression is not because of any kind of unconscious force, so it is because of the learned behavior. Okay, so they say that if it is learned, then it can be unlearned. So how it can be unlearned? They say that we have to provide reinforcement to establish healthier behavior. So this in context of behaviorals, I will give you some example actually. So someone please put on your mic and say according to behavior. So which movie this one is? Anyone please?
I can't see the slide. I can still see manic depression slide, 19th and 20th century.
Okay, I have changed the slide. Anyone can't see the slide picture?
No.
Okay. So you should say, right? I don't know why. Okay. Now is it visible?
Yeah, yes, ma'am. Yes, ma'am.
Okay, so if you can't see, then please let me know. Okay, so which movie it is? Yes, so you, whenever in the normal people, you will hear if someone have breakup, okay, they start drunk, so they loosely use this term, okay, तुम देवदास बन गए हो क्या, इस तरीके का है ना. So I have seen, and this is people actually perceive, okay, people actually learn by seeing, observing people in the movie, that okay, if someone is having someone have breakup, okay, someone have some bad day, so they should take alcohol. Okay, so people has learned this. Okay, and I will give a recent I'll discuss about a recent case actually. So I'm actually working in drug counseling and rehabilitation center. So he was like 18 years age boy. So when I asked him, so why did you started to drink alcohol, so he said that actually during that time I had breakup and I Kabir Singh movie भी आ गया था उस time पे. So I was very fascinated by seeing him, how he was so drunk after his breakup, and he had that long beard and he used to smoke. Okay, so he was very fascinated by that and he started drunk because of this movie only. So I was really shocked, like how people can relate. So when I ask him question to gain him insight, what he is doing is like not really wrong, doesn't have any rational thought behind that. So he was surprised to know that okay, he was just watching and observing, he learned this behavior. Okay, then so you can check the background whenever you get the substance abuse client, because I have seen that most of them, if I ask anyone, so they will say okay, they watch web series or movies which are very fighting, murder, substance abuse. Okay, so they like more fantasy movie. Okay, so which is not related to realistic. So they actually watch movies is real, not real, actually unrealistic movie they watch. So you can check it with your client also. Then last one, you can see this couple, you must everyone know about this story, right? So recently this girl murdered by his boyfriend and he cut him to 35 pieces. And how did he learn this? He learned from this by watching this web series. I don't know actual name of the web series. So he has learned this from the web series only. So you can see this how behaviorists are correct actually. Then see about the cognitive explanation. So Aaron Beck said that so people interpret, say every event has a negative aspect and the positive aspect. Okay, so Aaron Beck said that people when interpret any event as a negative one, so they contribute toward the depression. Okay, and he also said that people have actually negative thoughts and negative beliefs. So everyone have negative thoughts and belief, right? So and these are automatic thought whenever comes to our mind, but it is depend upon the individual to individual how they rationalize those and correct it, right? Then yes, so Martin Seligman, anyone can tell me who Martin Seligman, from which school of psychology? Yes, anyone? Please put on your mic and speak it. Hello? Anyone know about from which psychology school he is from? Am I audible? Dipra Sandhu said depression was the topic, I guess. It's depression only. Melancholic, it's another term of depression. Okay, positive, it was by the positive school of psychology. Okay, so he said that learn behavior, okay, helpless learn behavior, and people say that okay, whatever I will be doing, so it won't make any difference or any changes in our life. Okay, because of hopeless and helpless, depression happens. Then come to the diagnostic criteria according to the DSM-5. Okay, so according to DSM-5, it was given like from A to E. Okay, so according to the criteria A, so these are the two symptoms from these two symptoms, one must be present. Okay, persistent sadness, depressed mood or low mood, or person may have lack of interest in daily activity which were previously enjoyable. Okay, so among these, one must be present. Along with that, from these all 9 symptoms, okay, from five symptoms must be present, 1 plus 5. Okay, so and these symptoms should continue for 2 weeks. This is the according to the DSM-5. okay, like presence of sadness most of the time or of the day, like it will be every day. Okay, then withdrawn from the most of the regular activities. Okay, so the regular activities means which activities he was doing previously. Okay, but not he is doing at the present situation. Okay, then fatigueness, tiredness, weakness. So you can see in the most of depression client, they are already fatigued, they are weak. Okay, and sleep, it can be more or less. Okay, hypersomnia can also occur or insomnia also occur. Then means which and not in a regular manner. And appetite, appetite also, it can be increased also and it can be decreased also. So if appetite increase, definitely weight will be increased, and if appetite decrease, then weight will be decreased. So in case of if any negative event happen, then there might be feeling of guilty and hopelessness in life. Okay, in suicidal thought, like they must have suicidal thought, they may commit or not. Okay, if there is presence of suicidal thought, then it will count it. And they obviously, if they are very stressed out, okay, definitely there will be the no concentration and attention in their activities. The next A criteria, from the then B criteria, there will be the, obviously if person is not able to doing their daily activities, so definitely there is occupational dysfunction will be there, social dysfunction will be there, and they will be actually isolated, right? So in their connection with the family and relative will be also disconnected. Then and third condition is like this problem, whatever this problem is happening, so it should not be due to any medical condition or any other physiological problem. Okay, and D, according to D criteria, there should not be schizophrenia or schizoaffective disorder. Okay, and no manic episode or hypomanic episode. So if in case of presence of hypomania episode or manic episode, we'll diagnose as a bipolar disorder. Then these are the very important. Okay, these are the specifier, or if whenever you go for interview, they actually ask for this. Okay, these are the 5 types of the major depression. Okay, so mainly depression also have different types. Okay, today we are discussing here major depressive disorder, actually, which is very common case you get in the clinic. Okay, so first one is the with melancholic features. Okay, so when we call it melancholic feature, so if when client complain you that, okay, if just after waking up, the client have very sadness, okay, very depressed, okay, like they used to cry, okay, they feel very bad, in between the whole day they feel very low in the very morning. Okay, so their activity, they might be very hyper or very rigid type. Okay, kind of mutism. Then loss of appetite or weight gain. Okay, then excessive guilt and qualitatively different depressed mode, that is only. So highly depressed, which is not normal in the daytime. Okay, then come to the psychotic phase. So in already I have mentioned that there should not be schizophrenia or psychoaffective, but delusion and hallucination may be present, which is mood congruent. So what does mean mood congruent? It is mainly the feeling of guilt or worthlessness. Okay, the guilt, this hallucination and delusion will be associated with the guilt and wordlessness. Okay, so how it is, so they may hear a voice saying that you are very hopeless person, you can't do anything. Okay, you are the reason behind that incident. Okay, so such kind of voice, or if someone death is there, okay, a person see that person. Okay, so why we are calling it as a mood congruent when it will be mood incongruent? So other psychotic symptoms like delusion of reference, okay, delusion of persecution. So those are not, so only when it is related to the feeling of guilt and worthlessness. Okay. Then after that, this atypical feature, with atypical feature, so mood reactivity. So what does mean mood reactivity? Mood reactivity means when some person mood changes from brighten to the when there is any positive event. So when person is enthusiastic, okay, whenever something positive happens in his life, so he become energetic, or his mood become uplifted. Okay, so it is called with atypical features. Okay, then with catatonic features, so what will happen in catatonic feature? The person will have psychomotor activity, he may be mutism or maybe very rigid, okay, and also maybe high psychomotor activity. Okay, then last one is the seasonal pattern. Okay, in what happened in the seasonal pattern, so here the person will have the depression phase during the winter time only. Okay, but when he get into the this time, this summer or other spring time, then he won't have depression. Okay, then it will call as a with seasonal pattern. So next one is the cause and risk factor. Okay, so what can be the cause of depression? So if we talk about the genetics, okay, if it is genetical factor, so if there is family history present, okay, when we talk about the brain chemistry, like hormones like serotonin, okay, and dopamine, so when this dysfunction in all those hormone, then it will be depression can cause. Okay, the brain anatomy include like the limbic system is very responsible for our behavior and also to manage the emotion, like amygdala, hippocampus. Okay, so whenever there's problem in those set area, and limbic system present in the frontal area, right, so in case of any injury to that area, so that time also depression can happen. Okay, so these are the, you can relate the factor, how these causative factors are interrelated actually. Okay, so when there is presence of family history, okay, so when there is something problem with the parenting style, okay, so there an individual difference also, right, self is very important, right. So if there is faulty parenting style, and also there is presence of family history, and obviously there is due to the parenting only, individual difference also be influenced, right. So when there are those factor, so season may also can be a contributing factor. Then stress, presence of any life incident, right, any trauma, so all those, and the sleep pattern, so these are aggregated factor, and because of those contribution, there can be alternation in the brain structure and the brain chemical level, right. So these impact in the normal brain function. Okay, so when there is problem in the brain function, definitely his activity will be changes in the both brain and also in the body. So that after that this person experienced depression. So this Aaron Beck also gave this cognitive model of depression. So according to this, so if a person have early experience, okay, so if had previously he or she had any bad experience, so at that time what happened, they have a negative belief system. Okay, they form a dysfunctional belief system, and whenever such kind of incidents happen, so this negative belief activated. Okay, and this will create negative automatic thoughts. Okay, and because of this negative automatic thoughts, this symptom will occur. like behavioral changes, motivational changes, affective changes, cognitive and somatic. So whatever the symptoms we have discussed, so those symptoms can occur. Then next one is this negative cognitive trait. You must heard about it, this self and the future and the world. Okay, so this is the cognitive trait. So how the thought process are connected actually. So whenever he thinks that okay, I'm ugly, I'm worthless, less, okay, this thought is automatic thought is created by him or herself, right? So when he will think no one loves me, okay, so it's all hopeless because these things will always be this way. So by creating the automatic thoughts, then they will perceive the world that no one loves me, and this future thought created, and they will perceive the symptom of depression. Anyone have any question? Then come to the treatment part. Okay, it is very important. So how we decide actually treatment part is basically depend upon the person, causative cause. Okay, what is the reason behind because of what the person is having depression. So when we go for pharmacotherapy, so when there will be the history of any if person complain about their suicide, okay, and when there is very severe depression and there is lack of motivation from the client side, and the delusion and hallucination is also present. So mainly important is the client motivation. If client is not motivated actually, so it is very tough to make him cure. So for that purpose we may go for the pharmacotherapy, and then we go for the psychotherapies. So what are the therapies we can use? Okay, so here's everyone must know about him, Abraham Lincoln. Okay, he was the president of US, and he also had the major depressive symptoms. Okay, he also talk about the suicidal thought. So how he got cure from this? So what therapies he used? He actually used laughing therapy. He said that the jokes actually help him to regain from the depression. So laughing therapy actually he used at that time. Then you know about the William James. He is the father of the functionalism school, right? So he also have the depression, and he have noted that he used to rationalize his thought, right? So and also he used journalism. Okay, he wrote books because of his during the phase of his depression. He got the thought during the period of depression, and he came with the idea of the pragmatism at that time. Okay, and so we can from this we can identify that he used the therapies of journalism and also the rationalism, right? Cognitive therapy he actually used at that time. Then Sigmund Freud, everyone knows him, Sigmund Freud. So he also had depression, phase of depression. Okay, and you must know about he used cocaine, right? So he was also an addict also, and he had actually 33 surgeries because of his oral cancer, because he was also an chain smoker. So during this phase of depression he actually wrote the books and he also used the journalism to his cure his problem. Okay, and also he had the desire to gain recognition and fame. Okay, so because of that because of this was act as an antidote for him. Okay, then you know Gautam Buddha, everyone knows him. Okay, so he was a son of a king, right? And his father always tried to make him stay away from the suffering. Okay, people who are sad, okay, sick, so he always tried to make him stay away from those people. But when suddenly when he saw a person who had disease, so he decided to know the reason behind. Okay, he also in a phase of depression. depression. That's why he go for enlightenment and he search for the meaning. Okay, so we can relate his therapy, what his therapies to the field of the existentialism, and also the like he from his enlightenment he revealed about the inherent part of the existence. Okay, suffering caused by, so when we call it as inherent part of the existence, so we accept actually, right? So acceptance is very important in depression. Anyone is joining? Okay, so he used this. Okay, Gautam Buddha, whatever he find out, it is very related to the our present psychotherapies we are using, if we really go to the deep meaning. Okay, so he already talk about at that time about the acceptance, importance of the acceptance, and he talk about the attachment and the craving, right? So when we talk about the id gratification, okay, so when you talk about the id gratification, when there is imbalance in the id and super ego, so there is the problem arise, right? So we can relate attachment and craving in the those setting. Then same thing. And these are okay, this 8 novel part he taught, he say talk about the right understanding, okay, which means we can relate as a empathy. Okay, whatever right understanding means, what is the reality actually. In empathy we try to understand the other point of view also. Okay, so he talk about the thoughts, he right thought, right speech. If person having right thought, if person have voice thought process, so definitely his speech and action, which means his behavior and behavior will be definitely a good one, right? So he talk about the livelihood. So today we talk about the importance of the lifestyle, right? So there are some depression and all, so these are also related to the lifestyle and effort. So whatever the person, this motivation of a person. Then mindfulness. So mindfulness only, it is a mindfulness is also a therapeutic technique, you everyone know, and it improves our, if someone have mindfulness state, then definitely they will be aware about their problem, there must be concentration level, there must be attention level in that person, right? So whatever the Buddhism said, if you relate, so you will get that this present therapies. Then come to the what is existential psychology, how we can use the existential psychology in our therapies. So according to the existential psychology actually provided the philosophical thought, right? So according to the whatever the knowledge we gain from the existential psychologists, so we can, this knowledge can helpful to provide psychoeducation. Okay, so we understand the client's subjective world, means when we are gaining empathy towards the client. Okay, then accept personal responsibility means when most of the client happen that depression happen whenever they won't able to accept their reality, right? So here by according to existence, when we study more about the existential school, so we know how to provide acceptance in the client. When client blames other, therapist likely to ask them how they contribute to their situation. Okay, so means again the existential school again concern in summarize, we can summarize that they concern about the acceptance their reality, their the present situation. Okay, then come to the humanistic school. So I have made a video in this in my YouTube channel only. So if we talk about the humanistic school, it is very related to our life. It is very important actually. If someone is able to make the balance between all these 5 needs, then no one can have any problem actually. I'll explain how it is. So if some physiological needs means what? Okay, whatever we eat, food, air, water, clothing, sexual need. Okay, so whatever the biological need, so mainly what happen, people it is as also we can call as animal need, right? So one animal has the same level of need, so this is the very basic need. okay. And then come to the safety need, okay. So in safety need, like someone have bank balance, okay, then a property, then house, having a house, okay. If someone have food, then after that they will definitely look for a safety place, right? So what happened, mainly what happened, most of people are lying here only. You will see people, because of the workload, okay, they are so busy with their work, and they are so busy with work and their physiological need, okay, having a very luxurious life, so they are busy here only, okay. And they are so busy with that, they forget to make a good bonding with their family members. You will see when the client may come to you with like child whose parents are very busy with their work, okay. So they are so busy with their work, they can't give time to their child also. So their love and belonging part is missing, intimacy with the family, with the social. So they, some people you will see, they doesn't have any social life, so they are only busy with their making their life luxurious and having so many money. So these people thinks that the life aim of life is to earn money only, okay. So when there is imbalance in those, so if I take example of a substance abuse client, so when they are using substance, okay, so they doesn't have safety, they doesn't have any timing to go home, coming back to home, okay. So they doesn't wear a cloth properly actually, okay. So they doesn't take food and properly. So they are during this time they are more focused on the sexual need only, okay. So sexual need, they are focused on the physiological need, that is taking drugs or a substance and having sex, okay. So they doesn't focus about the safety purpose also, because so many client you will see they have a criminal history, so they doesn't focus on the safety part also. Obviously, if we take their example, they doesn't have love and belongingness in their life, okay. So if a client comes to you with depression, if they have a very lovely bonding with their family, so definitely their whatever the negative emotion they can share with their family member only, right? So if they are not able to share, so mainly loneliness present in the depression client, which means this love and belongingness part is missing in their life, okay. Then comes to the esteem need. So esteem need, like having status in this society, okay. So if it is imbalanced, then also can depression. Some people you will say low self-esteem. Why? They doesn't have, they whatever their expectation from their life, from their career, so they are not able to making it, okay. So because of that they may have depression, okay. So when you check out this area, you will see definitely imbalance in those patient, okay. And last one is the self-actualization. So self-actualization is whenever all those are fulfilled criteria, then person will be self-actualized. So a self-actualized person actually have a character of awareness, empathy, acceptance, all those character we have explained in the existential psychology. So all those self-actualized person will be having, okay. So actually when a person is self-actualized, they actually know their weakness, their strength, what are the area they are good at, okay. So all those the self-actualized person knows actually, okay. So when they knows and they are working on them only, okay. So their focus is not lying on this luxurious life and all, okay. So they more focus on the inner development, okay. So their thought process, okay, they more focus on their improving their thought process in the self-actualized person. Still someone is joining? So you will see imbalance in depression clients. Okay, then then other technique you can use in depression. So whenever comes to your client, you will say they are very fatigued, they are very tired, weak, okay, low energy. So at the time, you in the very first session after taking history taking and mental status examination, you can apply JPMR. Okay, in about the JPMR also I've made a video. So when you apply Jacobson progressive muscle relaxation technique, so actually physically person become relaxed. Okay, when they are physically relaxed, then they actually motivated to work upon them. Okay, then in the person-centered therapy, so what techniques you use from the person-centered therapy? Congruence, unconditional positive regard, and empathy. Okay, so there is depression present because there is incongruence in the client, right? So incongruence means what the society or the outside world is expecting from him, and whatever is he actually wants. Okay, the ideal and the real both have there is incongruent. Okay, so he is not becoming a person who is really. Okay, so he or she is acting according to the world only. So this concept you can teach the client. You can identify there is imbalance between the self and the ideal and the real client. Okay, real self. So unconditional positive regards means acceptance. Okay, so you have to improve the level of the acceptance in the client. Then empathy, definitely you show empathy towards the client, then only you will able to make rapport. So other technique like you can use empty chair and the role play. So when you can use empty chair in the role play, because whenever the client will have this some emotion which he or she is not able to release out. Okay, like I'll give example of my client. So she had death of her mother during the lockdown, and when she came to me, she said that okay, I was not able to spoke properly to my mother. Okay, so that was happened to the client, that client. Okay, so when she was not able to spoke to her mother, so she actually had some negative emotion, or whatever she want to vent out, it was the inside her only. So in empty chair, what you can do, the client will sit in a one chair, and the front one there will be another empty chair, and you can ask the client, okay, whatever you can see, or you can speak, you can speak to this, you can think that the person is in front of you, and you can speak to her. Okay, and sometime you role play how you can use. So what happen in sometime in empty chair, client will say how I'll talk to him, and this person is not in front of me, right? So how will talk to this person? So when you want that client to find solution by herself only, so you can say that okay, whatever the problem you are having, think that this problem is having to your friend. Okay, so think that you are your friend is having those symptoms, and your friend is telling you that okay, these are problem having to me. So what this suggestion you will give that person? Okay, so then that time this person will speak out. Then he will because when the problem the client has the problem, so the client is so much into the problem, so that they can't understand what will be the solution. So he or she actually depend upon you. Okay, but when you are giving this solution, it is like a suggestion for him, it is not according to him or according to you. You don't know his situation or his thought process, right? So the exact solution can be find out by the client. You can just provide guidance to the client. Okay, then we can use guided imaginary. So guided imaginary, when we use, like I'll give that example of my client. So when I use this empty chair, so she release those negative emotions, she cried a lot. Okay, so after that I make her through the guided imaginary, so I made a situation when she is in front of her mother. Okay, so at the in front of her mother, and whatever she is feeling, okay, whatever she wants to tell or what she can see. So that was that time she able to release all those negative emotion. So you can do this step by step. First JPMR, then releasing those emotion, then guided imaginary. Okay, so sometime you can use color therapy also. So how color therapy will be helpful in depression? So with the guided imaginary, you can use the color during the guided imaginary only to provide relaxation. Like you can ask the client, okay, you choose client a color which is comfortable or relaxing for you. Okay, so when I ask the client that question, so client will able to choose the color. So some color which provide the relaxation during depression, like blue color, okay, and green color. So blue color will give relaxation, and green color actually give peace of mind to the client. And when the client improve, not the very early stage, when the client improve to some extent after 3-4 session, you can use the after that yellow color also. Okay, yellow color and orange color. So why you should not use at the very beginning? Because when you use at the very beginning, this can be irritating for the client. Okay, yellow color is very bright color, actually orange color also bright color. So if you use at the very beginning, this can be irritating for the client. Okay, then you can ask the some magical question you can use from this solution focused therapy. So you can ask the client to acting as if. Okay, so if you can ask, counselor will ask, suppose if you believe the opposite of your current belief, how you will be behaving. Okay, so when you have to acting as if. Okay, so if means current patient will imagine, okay, this problem is solved. Okay, now you are in a stage that your problem is solved. So you have a solution actually. So how you will be acting in this situation. Okay, so they what happened when we use this technique? So the client actually gain insight. Okay, then after that we can use Socratic technique. So this is technique from the cognitive behavioral therapy. In Socratic technique, what we can use, like we can ask, mainly client have negative thoughts, right, in during the depression. So what we can ask the question, there are so many questions actually in Socratic technique. Some question like you can ask, okay, you did when you have you feel bad, so you don't do anything. Okay, you just sit in room. Okay, so what alternatively you can do, what action you can take because of which your mood can be improved. Okay, if you ask those questions, then client will gain insight. Okay, and then again you can when client actually don't have the insight about the problem, and they actually believe when they are fixed belief, they are not agree your situation. Okay, whatever you are explaining, he is or she is not agree with it. Okay, so you when at the time what you can do, you can ask the client to write in favor and in against. So we'll look for the evidence. Whatever you are creating thought, this negative thought in your mind, so according to this thought, your thought is have whatever you are saying, so what is this realistic, how much realistic. So if it is, you think it is realistic, so give evidence of it. If you do this, what will be the positive outcome will be you will be having. If you are having if you are feeling bad, you don't want to talk and you want to just sit up, and you think that if you are sitting alone, it will be helpful. Okay, so let me know what are the positive result. You will ask the client, so whatever you are doing, okay, I'll just sit alone, so let me know the result of it, what is the positive outcome. Okay, and in the other hand, he or she will write the negative outcome. So when they write those, so at that time they actually realize whatever they are thinking or whatever their behavior, so they understand the negative impact of it. Okay, then in the miracle question, this is also from the solution focused therapy. So in miracle question, what you ask the client, you will ask that, okay, think that one day you are you wake up from the sleep and you see that your every problem are resolved. So what are the changes you can see? Okay, so when your client is in depression and doesn't want to means if he or she is very actually resistant or lack of motivation, when you ask those questions, so they will be actually motivated, because when this is act as a reinforcement. Okay, when they see that okay, the problem is resolved, okay, the changes happen in my life, so they feel a relaxation, and this actually motivate them to act upon their problem. Okay, so and they also know able to know okay, what are the action can taken for to reach that problem solving stage. Okay, then self disclosure. So self disclosure actually very helpful. I'll share a case of client. She was actually 18 years old and she was in a state of mutism. Okay, she actually, I can call it as a mutism. Actually, she was very silent, she was not talking at all. She came with her mother. Okay, and she came with her mother, and when her mother actually said to me about her complaint. Okay, she was not speaking at all. Her mother said that actually she had very low self-esteem. Okay, because when she went to the school, so she actually has a dark complexion, so because of that people the friends used to call her Kali. Okay, so actually because of that she was very depressed. Okay, so at the time I was trying so many way to convince her, okay, at least she speak. Okay, so at the time I was not doing anything, so I told her, okay, you don't speak anything, I'll just share about my life story. Okay, so I also in reality also I was very fat in my graduation or in the school time, so my friend used to call me like Hati, elephant. Okay, so at that time I also used to joke with them. Okay, I also fight with them, so it was actually a fun for me. Okay, so when I explained my real life, okay, about my dark complexion, and I also show her my picture at that time how I was very fat. Okay, so when I for 15 minutes around 15 minutes I was only spoke about me, about my how I was not bad at study during, then how I improve. So when I explore about me, so at the time she actually spoke about her. Okay, and also you can use in such client, I also used her this strength bombardment. Okay, so I ask her, okay, let me know whatever yeah, there must be any compliment about you, not like any negative. So what are the positive compliment your clients gives to you? Okay, so sorry, not client, actually your friends. Okay, so when I asked that, so she told that okay, and also I gave compliments. She was having actually long hair, she was having big eyes, and eyes were also very beautiful. So when I started to give her compliment, and also I asked her that there must be some incident when your friend used to compliment yourself, so let me know about the incident. So and I asked her to write by herself only. Okay, so when she actually write her compliment about her, the positive point about her, so she actually talking started actually. Okay, so after the conversation of half an hour, she actually started to talk. Okay, so these are actually, you have to be creative while choosing the techniques. Okay, you can't just stick to some specific technique actually, so you have to use the different techniques from the different therapies. Okay, and lastly, these are the suicidal helpline. Okay, this one is from the Fortis Hospital, and this one is there for this organization Asra, and this one is the National Suicide Prevention Helpline. Okay, anyone has any question? Anyone wants to?
Excuse me, ma'am, I have a doubt. How is depression related to genetics?
Genetics.
Yeah.
If there is family history, Okay, if there is family history, so what happened, there are some actually every disorder or every problem, person have a specific genetic code. Okay, so if this same genetic code is transferred to from one generation to the second generation, okay, that time it can be cause of genetic. Okay, and genetic cause can be actually cause a factor for depression. Okay, it's there is need for the environmental factor. Okay, when there is environmental factor, I'll show you the screen. You can see here I have mentioned the when there is an contributing factor. Okay, if there is stress in life, okay, if there is any trauma in life at that time. Yes. Clear?
Yes, ma'am, it's clear. Thank you so much.
Okay.